Welcome to Simply Women's Health with CJ. I'm your host, CJ. I've created this channel as a place for you, the healthcare consumer, to come to get reliable information about the female reproductive system. These videos are in no way meant to replace a visit with your healthcare provider, rather as a place for you to come to get information that maybe will help you figure out what questions to ask at your next visit to best optimize your healthcare needs. If you feel as though these videos have been helpful, I would love it if you would subscribe and or like. If you know somebody who you think might benefit from this information, please don't hesitate to share these videos. I appreciate any and all support you can give. That being said, let's go ahead and get started. Hello, welcome to the third trimester. You can basically see the end from here. At this point, you are 28 weeks pregnant, and the third trimester actually ends with the birth of your baby. So this is it, the final chapter. Now that you're in your third trimester, every day you need to monitor your baby's movements. Every provider has a different way of recommending fetal kick counts, so when you go to your 28-week visit, you'll probably get some instructions on how to monitor movement. Bottom line, every day you make sure your child is acting right, and if at any point you're not sure, please listen to that voice in your head, trust your gut, and do those kick counts. What's normal? It's very normal at this point for you to have cramping, twinging, round ligament pain, those stretching pains down deep in your pelvis that happen every time you cough, sneeze, laugh, roll over in bed. What's not okay at this point is 5 or more cramps in an hour. It's not normal for you to have water running down your leg that isn't urine. If you have not already sneezed and tinkled, seriously, it is just a matter of time. It's not normal for you to bleed like you're on your menstrual cycle, and it's not normal for your baby to not move. Those are all things that you need to notify your provider if that is going on. Now that in your third trimester, we're on the lookout for a condition called preeclampsia. It happens in 15% of pregnancies. We don't know what causes it. We don't know how to prevent it. Women with preeclampsia have very, very high blood pressure. Now, you are not tracking blood pressure all day, every day, so symptoms that you'd want to be aware of. The worst headache of your life. It won't go away no matter what you do. You take Tylenol, you drink water, you take a nap, nothing works. Changes in your vision, black spots, flashing lights, tunnel vision. You bend over, you pick up a shoe, you get back up, you get those shooting stars that happen that go away in a few minutes. Those are normal pressure changes in your head and nothing to be concerned about. You're just sitting there watching TV, minding your own business, and you start having wonky vision, you start seeing halos around lights. Now you have my attention. If you start having burning behind your right breast, normal heartburn is up here where your esophagus is. Your liver is behind your right breast. That should never be on fire. So if you have those symptoms, again, please contact your provider. Now that in your third trimester, you are going to be coming to the doctor probably about every 2 to 4 weeks. Again, it depends on your provider's, their plan of care. When you come in, they're going to weigh you. Ideal weight gain in the third trimester is going to be about a half a pound to a pound a week. Remember that baby is growing pretty rapidly at this point. They're going to want to get your vital signs, especially that blood pressure. They're going to be monitoring blood pressure pretty carefully. When you come in, they're going to be measuring your tummy. For purposes of demonstration, I'm going to include a video of my daughter who is pregnant with her third baby. This is me measuring her tummy. So first thing we're going to do, we're going to measure what's called a fundal height. You measure from the top of the pubic bone to the top of the uterus. And the centimeters should match the weeks plus or minus 2. So my model here is 31 weeks pregnant. She's measuring right at 30 centimeters, which is ideal. Remember, plus or minus 2. Your provider is also going to want to check fetal heart tones. For purposes of demonstration, once again, my pregnant belly model is my daughter right here. So next thing we're going to do, we're going to figure out which way the baby is positioned. This little one is kind of just sitting just like this in her mama's tummy. And at 30 weeks, that's very normal. These babies move all over the place at this point. Once you figure out where the baby is, your OB provider is going to want to listen to the baby's heartbeat. This is a Doppler. We just put a little bit of warm gel on it. You put it right there. And our baby today has a heartbeat of 132. Anything between 120 and 160 is completely completely normal. Now that you're in your third trimester, it's also time to start preparing to be a mom. Things that you might want to consider: how do you plan to feed this baby? Are you going to use formula or are you going to breastfeed? Breastfeeding is what I strongly encourage. There's lots and lots of advantages to breastfeeding. But it is a personal choice, but if you have questions about breastfeeding, most certainly ask your OB provider. Time to start thinking about pain management in labor. I'm not going to lie, when you are pushing a person out of your vagina, there is a certain amount of discomfort that goes with it. Lots of different pain management options. Again, you will want to check with your local delivery facility and see what they have available for you. Now's a good time to start thinking about birth control after you have this baby as well. So lots and lots to think about. Until next time, this is CJ. I'm at your service.